Today, we'll be discussing aortic stenosis in medical briefs. At its core, aortic stenosis is the narrowing of the aortic valve, which causes obstruction of blood flow from the left ventricle to the aorta. This narrowing creates pressure overload in the heart. As a result, the left ventricle undergoes hypertrophy, meaning it thickens to cope with the extra work. If left untreated, this can eventually lead to heart failure. Let's focus on the key symptoms of aortic stenosis that you should recognize. The primary complaints often include shortness of breath with exertion, which means patients become breathless during physical activity. This breathlessness is a crucial early sign. Next, we have fainting episodes related to exertional stress, or syncope on exertion, where patients may briefly lose consciousness when physically active. Finally, exertional chest pain, typically characterized as angina on physical activity, is another important symptom indicating the heart's struggle to meet increased demands. When assessing aortic stenosis, there are several characteristic signs we need to be aware of. First, the apex beat is heaving but not displaced, which reflects the increased effort of the left ventricle. We hear a harsh ejection systolic murmur best over the right second intercostal space, often radiating to the carotid arteries. In more severe cases, the second heart sound can become soft or even absent. Moving on to the pulse findings, patients exhibit a narrow pulse pressure, meaning the difference between systolic and diastolic pressures is reduced. The carotid pulse is slow rising and of low volume, typical for this condition. When examining a patient for aortic stenosis, we must assess for signs of heart failure and any other valvular lesions to get a full cardiovascular picture, along with the other associated signs. This slide highlights the critical role of transthoracic echocardiography in managing aortic stenosis. It not only confirms the diagnosis but also helps determine the severity of the stenosis and assesses how well the left ventricle is functioning. For treatment, it's crucial to differentiate between medical therapy and definitive treatment. Medical therapy mainly focuses on relieving symptoms and managing associated conditions, but it cannot reverse the narrowing of the valve. On the other hand, definitive treatment involves valve replacement, which can be done either surgically or via transcatheter aortic valve implantation. The choice between these options depends on factors such as the patient's age, other health problems, and surgical risk. The key takeaway message is to understand the classic triad of symptoms includes angina, syncope, and shortness of breath when suspecting aortic stenosis. Thank you all for your attention today. Remember to follow medical briefs for more high-yield videos on MRCP, UK, MRCPI, PACES, and internal medicine.